We have 5 speakers today, 3 from the RGP of Toronto, Dr. Barbara Liu, who is our Executive Director, myself, Wendy Zay, I'm a Project and Quality Manager, and Alekia Johnson, who is our Knowledge to Practice Manager. And we also welcome 2 very special guests from the Northeast Specialized Geriatric Centre, which is a member of the RGPs of Ontario. Tracy Byron, a registered nurse who is the Senior Friendly Care Lead for Algoma, and Shane Gingrich, a physiotherapist and geriatric knowledge translator. Before we get started, I'd like to just let you know how you can engage with our speakers today. Please type any questions you have in the chat box and we'll answer them at the end of the presentation. And I'll start by answering the most commonly asked question: can we have a copy of the slides and video for this webinar? And yes, you can. We'll send them to attendees and post them on our website. And with that, let's get started. So we'd like to start off by taking a poll of the audience. We want to know, what is senior-friendly care? What do you think senior-friendly care is, or what does senior-friendly care mean to you? Please type your answers in the chat box. The first 5 people to answer in the chat box will win some free laminated tools from our learning series. What is senior-friendly care? Great, people have got some excellent ideas. I'll just start reading out a few. So person-centered to their needs and interests, care that helps the senior optimize their function and prevent decline and deconditioning, care that's person-centered. So there's a lot about person-centered to people on this webinar. And lots of great additional answers here, which we'll look at later. What matters to them? Wonderful. Care that optimizes function. All great stuff. So thank you to everyone for entering your ideas here. And we'll get in touch with the first 5 who pop their answers into the chat box to get you those free tools. So to put it simply, senior-friendly care is about optimizing the unique needs of older adults. We thought that statement sort of captured it in a very simplistic way. And this is a screenshot of our poster for senior-friendly care that all organizations are welcome to use. Now, we won't spend much time on the background, but we wanted to highlight where the Senior-Friendly Care Learning Series fits in with our other resources. So the Senior-Friendly Care Framework, as many of you already know about, provides that foundation for achieving the best possible outcomes for older adults across the continuum of care. And the framework is based on 5 domains that provide a holistic systems approach. So there's organizational support, which addresses the elements that are required to create a solid foundation for senior-friendly work, such as leadership structure, staff development, policies, strategic priorities, system collaboration, and measurement. And then processes of care really underlines the importance of evidence-based care, which is critical to older adults and specific to older adults, and it's aligned with their goals and preferences. Emotional and behavioral environment focuses on care that's provided in a way that is respectful, compassionate, sensitive, and free of ageism. Ethics in clinical care and research addresses equity and rights. And then finally, the physical environment promotes the need for physical spaces that are conducive to the needs of older adults. And this goes beyond mandatory accessibility requirements. Now, after we launched the framework, we received requests from organizations for help to actually implement the framework. So as many of you know, in the last year, we launched a Getting Started Toolkit, which comprises a self-assessment tool, implementation resources, and introductory videos for staff and executives. And we also are pleased to offer support to organizations as a strategic partner for organizations who are preparing to become Ontario health teams. We know that many of them are especially looking at seniors and frail seniors as their population of interest. So please do connect with us to learn more about how we can help you if you've already applied to become an OHT or you're considering application. And that takes us to the resources that we will be discussing today. So the Senior Friendly Care Learning Series supports clinicians across the healthcare system who want to provide senior-friendly care. And the starting point for this series was the Senior Friendly 7 Toolkit, which some of you may also be familiar with. The As of Care Learning Series comprises introductory education modules for clinicians, along with supporting posters and patient handouts on 7 key clinical topics: delirium, mobility, polypharmacy, pain, loneliness, nutrition, and urinary incontinence. I'll turn it over now to Dr. Liu, who will speak about the need for the education series and provide a few highlights about the format of the education modules.
Thanks very much, Wendy. There's a tremendous need for educational strategies and resources to support workforce development to provide care for frail older adults. There's lots of evidence of this need and gaps in knowledge amongst healthcare professionals that's been identified in the literature. And I'd like to just give you a few examples of this evidence. In a national survey done by the American Geriatric Society, the median time devoted to geriatric education in medical schools was only 9.5 hours. 9.5 hours over the course of an entire physician's medical school training. Not surprisingly, medical graduates also validated this finding in various surveys, saying that by the time they were entering into practice, they felt that they had received inadequate coverage of geriatric topics. When we look at other professions, we also see similar results. Only a third of baccalaureate nursing schools and only 20% of associate degree nursing programs report having a standalone geriatrics course. Even in amongst advanced practice nurses, a survey of 500 nurse practitioners in New York State revealed that the majority of respondents felt only somewhat comfortable to provide care for older adults, and they felt particularly challenged in the areas of disease management and psychosocial issues. When you look at the other professions, similar results are found, including for schools of pharmacy and rehab professionals. So from across Ontario, we received several requests for resources to support both organizations, as Wendy had already talked about, as well as the individual clinicians who wanted to improve their capacity and competence to provide care that meets the unique needs of frail older adults. So how do we go about meeting this need? What people said to us was that they wanted to have resources that were made in Ontario, that focused on the care of frail older adults, that were designed for clinicians with little formal training in geriatrics, and were offered free of charge. And those were the principles that we used to guide us in the development of the Senior Friendly Care Learning Series. So what's the format of this series? Well, it includes PowerPoint presentations that are built around a case study, include discussion questions to facilitate participation and involvement of the groups that are looking at the series. There are up to 30 minutes of slides in each deck, and each deck is accompanied with speaker notes. So you don't have to be an expert to use these PowerPoint presentations in settings such as lunch and learns with your own teams or within your own organization. Those speaker notes can guide you. And then we're also here to help with any questions that you may have. So looking a little bit more deeply into some of the content of the learning series, for example, this is a flavor of what you'll see. In the nutrition module, we have included practical approaches that can be applied across the continuum of care. So in the home and community care and primary care sectors, you can use the Nutri-E screen tool. In hospitals, you can use the Canadian Nutrition Screening Tool. And in residential care, you can use the mini nutritional assessment. And all of this is evidence-based and tailored to the different sectors in which the care is being provided. Another example here from the polypharmacy module, we've distilled key information into quick and easy to use tools. And we spent quite a bit of time working with not only the experts in the field, but with potential users to make sure that this information was clear and easily absorbed and presented in a concise way. We provide practical strategies that you can implement right away that are based on evidence. And this is another example from the urinary incontinence module, changes that you can advise patients to take in terms of lifestyle and the evidence that supports some of those suggested changes related to physical activity and lifestyle changes related to smoking and caffeine use. So those are some highlights from the learning series, and I'll now turn it over to Alekia, who tell you a little bit more about other content in the learning series, the posters and handouts.
Great, thank you so much, Dr. Liu. So the second element that you can see on the screen now is our organization posters. So we have one poster for each of the 7 clinical topics. And the purpose of the poster is to encourage older adults and caregivers to feel comfortable asking questions about any of the health topics, particularly issues such as incontinence that tend to go underreported or underdiagnosed. So each of the posters has a set of questions that they can ask their care provider. And there's also a slogan on each one that says, "Your care is why we're all here." And the idea is to create a safe space for older adults and caregivers to ask the questions that are important to them. The third element in our series is handouts. So once again, we have 7 handouts, one for each of the different topics, and they include practical suggestions and tips for older adults and caregivers. So in this one that you see here is on delirium. You'll see that it has sections know, do, tell, and ask. So we try to keep them really practical. And the purpose is for providers to use this tool in their conversation with the older adult or caregiver. And then after the visit, that individual can take it home and they have a list of things that you've talked about with them. So this is one sort of example. They don't all look the same. So what you see on the screen now is our loneliness handout. And if you look at our loneliness PowerPoint module, you'll see that we have outlined an approach for how you can detect loneliness and then probe as to the causes of loneliness. And then this handout you can use after that to collaborate with the older adult or caregiver to come up with some activities that they can do inside and outside the home. So you can also think of this as a social prescription. This next one here is also a little bit different. So this is our mobility handout, and it's also 2-sided, and it has some exercises that can be done at home. And this particular handout is targeted towards older adults who would score maybe moderate to severely frail on the clinical frailty scale. So now that you've heard a little bit more about what is included in this series, you might be wondering, what is the best way to use these materials? So the answer to that is it really depends on your organization, and you can customize it to suit your needs. So it's not prescriptive at all. So we have some ideas here on the screen on what you could do. So you could deliver the PowerPoint deck in 10 to 15-minute intervals instead of all at once, if that works for your team. You can add in your own tools to supplement the content. You can also talk about real cases that your staff are working on rather than the examples that we have. You can also complement your training with some of our webinar series that happen once a month. If your organization has a learning management system, you can also integrate these PowerPoint modules into that system, and you can also feel free to add your own organization logo as well. And then the last idea we had here was that you could discuss the handouts at one of your regular team huddles or meetings. So select one and talk about that each week or however often your team meets. So what are people saying about this series? So a big thank you to any of you that reviewed some of our drafts, and for those of you who've also reached out and sent us emails since our launch date earlier this month. So we've heard from clinicians across the continuum of care who have said that they find these resources comprehensive and they plan to integrate these into their plan for clinical education. So thank you so much for the positive feedback. We are very open to hearing suggestions for how we can do better, so please do connect with us after this webinar with any suggestions, comments, or feedback. So we are going to have a social media contest. So if you have one of these social media platforms, Facebook, LinkedIn, or Twitter, The first 15 people to follow us and share one of our posts on the Senior Friendly Care Learning Series will win some free laminated materials. So you don't have to go on all of them, but if you have one of these platforms, we would really appreciate it if you would follow us and share about the learning series. The purpose really is we want this to go as far and wide as possible, and for as many people to learn about the series and be able to access it. So after this webinar, please take a few minutes to do that and you might win a prize. So at this point, I'd like to turn it over to Shane and Tracy, who are two clinicians who plan to use this series. So take it away, Shane and Tracy.
Good afternoon. This is Tracy Byron speaking. I'm so happy to be here. Just a quick introduction about myself. I'm a registered nurse by trade, and I've worked for the last 27 years in many different facets of healthcare. My newest and most exciting role that I've just taken on within the last few months is that of the Senior Friendly Care Lead for the subregion of Algoma, working in partnership with the Northeast Specialized Geriatric Center out of Health Sciences North. My role really as the Senior Friendly Care Lead for Algoma is really to help to build capacity in the care of our frail older adults across the continuum in many different organizations, supporting an integrated approach to the care that we provide our frail older adults. And I'm just super happy to be here and to be a part of this webinar. So thanks for having me.
And good afternoon, everybody. This is Shane Gingrich. Again, I'm also very happy to be here today, so thank you for the invite. And I'm a physiotherapist by background. I've been at the Northeast Specialized Geriatric Center since we opened back in 2009. Most of that time, up until last year, was spent as a geriatric assessor and physiotherapist. I've always had a bit of a passion for teaching and capacity building, and we're fortunate to have funding to create some new positions. So our 4 senior friendly care leads and another position as knowledge translator. And I've been working as the regional geriatric knowledge translator for about 1.5 years now. In this role, I support all of NESGC's priority education and capacity building work. So we do some work with Baycrest to host Project Echo, Care of the Elderly. We do a lot of capacity building for both our staff internally, our teams, and externally, and then working to support the sub-region senior friendly care leads. So a little bit about how we ended up invited to this webinar. Tracy and I reached out actually to Wendy. So this is a lesson. If you reach out to Wendy, you're going to end up on a webinar. I'm just teasing, but we reached out to get a better understanding of essentially all things senior friendly care as we were preparing to transition from the current education we were using, and in the Northeast, that was niche, and transitioning over to something different. And we'll talk about that in a few minutes, how this is so timely with the learning series being launched. So in that conversation, Wendy said, well, why don't you come on this webinar? Tell us a little bit about your journey so far, and perhaps we can help you learn from some of our successes and challenges over the last little while. By no means are Tracy and I experts at this. We are working our way through it, just like all of you. But I'm going to pass it back to Tracy now. She's done a lot of the heavy lifting with rolling up her sleeves, learning about all the educational offerings, and helping to smooth the transition from niche to senior friendly care. And you can advance the slide, please.
Thanks, Shane. So I just wanted to start off by showing a pictorial representation of a lot of the offerings that are out there with regards to senior friendly care and best practices in geriatrics. And you'll see here, this is definitely not an exhaustive list, but it just goes to show you that there's really no lack of offerings out there for the care of our older adults. And you can see there's niche. Shane spoke about that. I'm going to go into a little bit more depth about niche. I know that a lot of organizations across the Northeast have been participating in the niche program and really looking towards how do we migrate to a more Canadian user-friendly tool that we can, improve the care that we provide to our older adults. We're all familiar with the best practice guidelines that really help to guide a lot of our care. The HQO, the quality standards, providing us with best practices across a lot of the care that we provide to our older adults. The comprehensive geriatric assessment, the competency framework, and then the newly released Senior Friendly 7 Toolkit, which is really exciting and user friendly. But just goes to show you that there is a lot of focus put across Ontario and other provinces as well with regards to the care that we provide our older adults. Next slide, please. So Shane gave us a brief overview of how Shane and I both were involved in this webinar and how we came to be. And really it all started with a few of the organizations across the Northeast, specifically in Algoma, looking to transition from niche, which they were committed to and registered as participants in, and how they could transition to the Senior Friendly Care Learning Series. At the time of our original ask, the learning series wasn't launched yet, but we were provided with the toolkit, which has some great information and really helped to ensure that we weren't missing anything. So really the task that we undertook was doing a crosswalk of educational offerings or content that was provided by niche and comparing that to the offerings in the RGP Senior Friendly 7 Toolkit, and now the learning series. And really what we found was that there was consistent recommendations for best practices, whether they be screening tools, assessment tools, interventions, transitions home. They were consistent across all of the educational offerings. The 7 key topics that are focused on in the Senior Friendly 7 are very well supported with different resources, and like we just saw, the wonderful PowerPoints with the speaking notes included, which is super exciting. The handouts and the posters, all of that is really, closing or mitigating any risk or gap in learning experience from niche, really, but really incorporates all the learnings from all of the other options of education. And to boot, it's free, and we heard of, really given carte blanche of how to use the Senior Friendly Care Learning Series. Really, the risk really was stomped out in the worry of people thinking that if we abandon niche or any other learning series and head towards the Senior Friendly Care Learning Series, people were worried that we were going to miss out, and we definitely are not. We are actually gaining a lot of educational resources and tools that we can use to bring this to fruition. And really, I think the key is that it's Canadian, it's homegrown, evidence-based, and it really ensures that we're all providing the same standard approach to the care that we provide our seniors across the Northeast LHIN and across all of Ontario. Next slide, please.
Thanks, Tracy. That's a really great summary. And I, looking back on our experience with niche, and I want to preface this by saying we are not anti-niche. I think they have done a great job at, developing their learning materials. It served to provide many clinicians across the Northeast with, some credentials and opportunities to access some didactic education, some foundational knowledge in geriatrics. But I think the biggest learning we've had, and probably, it's not earth-shattering probably to those of you who work in education full-time, is that the need to be really, really clear about the goals of capacity building from the outset. So I think, paying for niche for several years and implementing it the way we've done, the best we knew how, was people running through these modules on their own, having credentials as this geriatric resource clinician or patient care associate, which is great. And then we sat, 3 months, 6 months, 9 months, 12 months, ongoing post-education saying, but wait a minute, practice still hasn't changed. What's going on here? So, even though it seemed easy and it was great and we've got it all there, we just didn't quite get to the level we were hoping for. So this is why, for us, particularly in the North, this is very timely as we're transitioning away from that to now take a moment and look back on what we might do differently as we transition over to using this learning series and all the senior-friendly resources that we have available to us. I think the ability to take what you've provided us and put a personal spin on it is really going to help us to use the resources and change how we're caring for older adults that we see, and challenging people, and we'll talk about that in a minute, to move away from that traditional sort of metric of number of clinicians trained. And maybe that's okay for some. If the goal of your education or capacity building is to have a certain percentage trained and the goal is to inform them, then that's fine. That's a different type of education. But for us, we really wanted to see changes at the bedside. And when that wasn't happening, we had to take a step back and think, okay, now what are we going to do? And I will say we are very fortunate to have our senior-friendly care leads up and running here in the North, because that is a huge, huge resource that can help organizations to do some of this work. As you know, people are busy and often working on these projects off the side of their desk. So having these folks be able to help is, I recognize, very, very fortunate for us here in the Northeast. So some ideas that Tracy and I are working with is rather than releasing everything all at once, but building a module of the month, perhaps using Senior-Friendly 7 modules, and pairing that didactic learning with perhaps subject matter experts to provide face-to-face education. As you mentioned earlier, perhaps using it in huddles or lunch and learns. We can incorporate it into the learning of new staff or onboarding, which I think is a great idea. Offering hands-on learning opportunities, and then not losing that piece of the shoulder-to-shoulder coaching and mentoring, having folks on the unit who seem passionate about these topics. I think the trendy word now is to say influencers or champions who, the staff might turn to for answers. Hey, I just learned about this. Can we work through this case together? Another example we've done in the North with another senior-friendly care lead who I know is on the line, Nicole, I'm giving you a shout out, is developing a community of practice in one of our organizations where the staff are really leading the change as we build capacity around the geriatric giants or geriatric syndromes. And then, of course, the what's in it for me. Those of you who know me, I have a very rainbow and sunshine view of the world, and though I'd love to believe everyone is motivated by knowing that learning this stuff is improving patient care, I am realistic. I know that it's not the case, and everybody's motivated differently. So do what you need to do. Sometimes that's providing a little bit of a snack or a treat for folks, or a bit of an incentive. Swag goes a long way. Environmentally friendly swag, I like to say, but pens or pins. Some people knowing they're getting professional credentials or educational credentials, that's enough to drive them. And I think another great example I want to highlight here in the North is the work that was done is continuing to be done at the North Bay Regional Health Center. And I know the developer for that program, Debbie Hewitt-Colborn, and I know she's on the line, not to put you on the spot, Debbie, but they developed a wonderful approach to capacity building at the hospital where they combined a few different things. So some senior-friendly care resources with a few niche modules, and then gave learners the opportunity to choose modules that they have a passion or interest in. And then it kind of built a bit of a buzz, created a bit of a buzz at the hospital that as more and more clinicians were trained, so this was targeted at PSWs, nurses, and allied health, and I believe they wore a pin to identify themselves. People said, well, geez, now I want to do that. And they've had a lot of positive feedback and have graduated, I think at last count, Debbie told me 127 people to date and more in the current program. And they were so successful. In fact, they went on to develop a leadership stream to do similar training with their board members and senior leaders and directors. So I don't know if we can pause for a minute, Debbie, not to put you on the spot, have I done justice at explaining that program? Or did you want to add anything there? Oh, there's a message in the chat from Debbie, and she said absolutely. So maybe we'll keep going. I know Debbie, do you want to maybe put your email in the chat? I know you had offered to reach out, or people could reach out to you afterwards to hear about the great work you've done.
Sure, and I think I just unmuted as well. Someone gave me that option on my
Oh.
screen. So yeah, no, thank you so much for recognizing our program. It has been quite an exciting one, and we've had lots of great response. And I think that ability for people to really tailor it to their unique needs that they want to learn more about has been really successful. So no, thank you very much for doing that. And I'll put my email in that chat pod. Thanks.
Thanks, Debbie. And I think I'm going to hand it back to Tracy now, just to kind of walk through an example of what we might, we picked randomly the topic of continence, but what a multi-layered approach might look like when we're implementing some of these resources we're talking about today.
Thanks, Shane, and thanks, Debbie, for allowing us to kind of point our fingers at you in being one of the leaders in putting knowledge to practice. I think it's awesome, and thank you for allowing others to reach out to you. Like Shane had said, we had developed a few different ideas of what education beyond the didactic learning would look like. And I think it's important really to help others to build the solid foundation in the care of our older adults so that it's easier for them to implement and then to build off it. So this is just an example, like Shane said, using the continence module. So, we took the approach of using like a module of the month. So we would do everything continence for the month of, say, August. And you can see in the standard educational resources or methods, those are, a ginormous list and maybe not an be all end all list, but ideas that you can use to build off and create an educational program based for each module. So this was really standard across the board for each module, with the exception of the metrics that you may be capturing. I think that sometimes in order to make things matter, we need to measure it, and we need to show people that what you're doing, the learning that you're, the education that you're taking in and you're learning really has the ability to impact our patients. So for example, if we're talking about continence, obviously there's the Senior Friendly 7 module in the Senior Friendly 7 Toolkit, as well as now the newly released Senior Friendly Care Learning Series. Looking at that module, looking at other online modules, using the organization's own policies and procedures and protocols to drive that, geriatric order sets, and then ways that you can, kind of extend this information to others is, at your meetings, huddles. We know that sitting in a classroom doesn't always fit everybody's learning styles. So really meeting people where they're at. I know in, my recent past, providing education to frontline workers is really embedding myself with them shoulder to shoulder, having the conversation maybe at a quick huddle, but really doing the mentoring and coaching as they're doing their work on a daily basis. Also, the great posters that we're free to print and add our own, hospital logos or organization logos, perhaps having guest speakers. And like Shane had said, using the people in your own organization who are passionate or the subject matter experts in a certain topic. They have a lot of street cred when it comes to, sharing information with their colleagues. So really using those people and elevating them to be, champions of the work that we're trying to, improve upon on each topic. Like I said, using metrics that matter, showing people really what learning about this information and providing best practice care, the impact that it has on our patients at any place in the continuum of care. And then, like I said, using your champions and building champions. Maybe there's somebody who's not an advocate or not an expert in continence, but really want to be. So pairing them up with either yourselves being the knowledge translator or the person providing the education, but also the experts in the field to enhance their learning and then allow them to be champions of the work. We know that really is going to have a great impact and on how we provide the education, but not only providing the education, but how people digest the education And once it's hardwired and put into practice, there's somebody there to kind of coach and mentor and provide, subtle reminders or, education tips along the way. That's really going to help influence the change in practice. It's very easy, as we all know in our busy lives, to have somebody just read this policy or read this module, but really having the ability to put it into practice, have somebody, guide you along the way, be able to ask questions. That really helps to build it into a habit and the way that we actually provide care. And I think that is really what's going to help to change practice. And I think that's it for that slide, unless anybody had any questions. And again, this isn't, a cookie cutter that would work for everybody, but just an idea of different ways that you could provide education. And with that, I just want to, end it with a special thank you to Dr. Barbara Liu, Wendy, and Alekia, and all of the team at the RGP for allowing us the time to share our journey so far and some of the tips and tricks that we've learned along the way. And I thank everybody who's, joined the webinar today. It really shows a commitment that we all have in improving the care for our seniors across the continuum. Really thoughtfully, intentionally, and not just ticking the box, really looking to get to the root of building the capacity and improving the care that we provide at the level of the patient. And so we've included our contact information there, and we're very open to, being contacted. And, we can't do this on our own. I think that the more people we have kind of steering the ship in the same direction, the better. And we look forward to continuing this great work with all of you. Thank you.
Thanks, Tracy and Shane. That's a terrific introduction to all of us about the work that you're doing. And it sounds like you're well on your way on the senior-friendly journey and are continuing to do wonderful things in the future. So we do have time for questions for you, and maybe I'll just start things off. You already articulated some of the reasons why you felt that the senior-friendly care series was appealing, but if you had to pick just one feature of the series, what would you say was the most convincing aspect of this series in terms of meeting the needs that you have in your region?
So honestly, I don't think that I could just pick one. So you're restraining me by telling me I can only pick one. But in general, just the compact, the comprehensive overview, the knowledge that's been put into it, so the evidence that's behind it, and that I know that it was created in collaboration with many, and the ability, I think the best thing for me is really the ability for organizations, no matter, hospital, community, long-term care, they have the ability to take it and make it their own, definitely with your permission. So I think that's probably the best piece of it for me, that it's so, the ability for it to all be personalized. And I don't know, Shane, if you wanted to add to that as well.
Yeah, I too have about a list of 12, but I think if I had to pick just one, as I'm sitting here actually listening, one thing I hadn't thought of before we got on the call today, when we were just talking about the posters and the handouts, makes me think of some of the work I'm doing on the caregiver education project provincially as well. That piece, although my focus I think has been on the presentations, those pieces are huge for clinicians, helping to facilitate the discussion with patients and their caregivers. Often you're in that moment feeling quite desperate to help caregivers, and how, what can I do? And so I don't think until maybe getting on the webinar today did I fully appreciate how those resources could be used. So for me, maybe that's a new learning from today.
Thank you. And you alluded to the fact that the ability to modify and to make it relevant to the context in which you're implementing was really important, an important feature. And with your experience as knowledge to practice leaders and education and capacity building experience, what would you say are some of the factors that people should be looking at in terms of the context in which they're going to use this learning series? What are some of the things that people should be considering when they're thinking about what modifications might be needed for their local implementation or use of these tools.
Do you want me to take that one, Tracy?
Sure, go ahead.
Yeah. Well, I think it's great that you've given permission for people to do this, because so many times, clinicians or educators are left either creating their own material, which we know how, just doing a lit review for a talk can be days of work. And also allowing people to do that gives them the opportunity to take the proper time to get themselves ready for implementation. And I think, it's very exciting. We all want to dive in. We all want to get these resources out there. I can just imagine, if you look at your website metrics, how many clicks and downloads and tweets you've had about this. I think taking the time, understanding the needs of your organization and the goal of what you're trying to do with this education. I mean, for some, as I said, it might just be informing, in which case we may measure, as Tracy said, use one metric, or we may use it on a specific unit to change how we practice around falls or delirium or continence. So again, a learning for us, certainly in the North. It's a lot harder to do that stuff retrospectively. So although, hey, and we were the first two when that website came, or when they were launched, I'm sure Tracy and I were number 1 and 2 for downloading. We are very excited, but I encourage everyone to think about how you want to use this, and really what your goals are, and then take the time to develop a proper work plan, what it's going to look like, find your champions, how are you going to encourage that mentoring component or influencers, building that into your practice, and building evaluation from the beginning so that you can take credit for all this hard work that you're doing, and show at the end of the day that we've achieved what we want to do with it.
And I think if I can add something, just as Shane was talking, I know that a lot of people, there's so many competing priorities in any organization, no matter, what your position is. And I think that the way that the learning series has been developed, it has made it, it's so much easier to adapt it to your own setting. But really, if you were to, and I'm doing air quotes, if you were to just take it out of the box, it is something that is so, so easy to just do a simple presentation. If that's really all that you have time to do, if you can't go wrong with just taking it out of the box. But I think it is important that if you can take the time, and like Shane said, do some very thoughtful planning to make it your own and really put it into the context of your organization. But either way, you can't go wrong. You can just make it better by contextualizing it, if that makes sense.
Tracy and Shane, thank you so much. We're going to open it up to some audience questions now, and I can see we've got some coming in. And one, and this is Wendy, since we've got 5 speakers, I should introduce myself again. We've got one actually from a colleague of yours in the Northeast, Wendy Carew, who is looking to use the resources outside of the hospital with community care and support services, primary care, long-term care as part of Stay on Your Feet Northeast. She's asking, should we be connecting with Northeast Specialized Geriatric Center to coordinate our efforts to be sure we're reaching the region? So good question about regional coordination here. What are your thoughts?
That is a very good question. And I say hello to Wendy. Wendy and I have worked very closely together for a few years as co-chairs for our regional steering committee for Stay on Your Feet. And yes, Wendy, I've already seen your email. I look forward to figuring this out together. We don't have a plan in place yet, but I figure after today, we'll have to put our heads together and having these resources in each of our subregions. So having a senior friendly care lead in each of the subregions will be a huge advantage for us moving this work forward.
Great. So I'll encourage other attendees to please feel free to type in the chat box any questions you've got for Tracy and Shane. I see another one here right now about geriatric order sets. Where can this be found? So I'm guessing that somebody would like you to share your geriatric order sets if you're able to.
I can help to share the geriatric order set. I will ask for permission before I share it with the organization that I had done some work with previously. But I know that there is actually a template, again, I'm using air quotes, on the patient care order sets. It's a program that some organizations have. But once I have the permission from this organization specifically, I'll be sure to send it out. And I'm not sure if it's a global email or if I send it to Wendy and she can disperse it. Whatever's going to be easiest for all. I just want to make sure that I, get the permission before I share.
Great. Yep. If you send it to myself and Alekia, we'll make sure we share it with all the webinar attendees if you are indeed able to share that.
I'm sure there will be no problem, but just formality, I want to make sure that I do things the right way.
Great. So I don't see any other questions in the chat box, but do encourage people to please type them in if you have any. And I'll pass it over to Alekia, who will tell you just a little bit more about where to find the series and who was involved in creating it.
Wonderful. So if you haven't already done so, you can access the learning series on our website, rgptoronto.ca. So under the initiatives section, you'll see a senior friendly care page. So click on that, and then on that page, we have a button that says go to the learning series in green. So just in case you're having trouble finding it. And as Wendy said, we really want to say a big, big thank you to our clinical experts. So we had one expert that collaborated with us on each of the different topics. So they contributed a lot of expertise and content for the modules and as well as the handouts and posters. So you might recognize some of these faces. Thank you to Paul O, Martha Spencer, Paul Tumber, Larry Jackson, Heather Keller, David Ryan, and Eric Wong.
Great, thanks. So I see another question coming in. Are we developing a module on frailty? So we could. We don't have that in the pipeline right now, but we are creating other modules. We're looking at advanced delirium, ageism, and some other modules as have been requested in feedback that we've gotten from clinicians. In terms of addressing frailty, all of our clinical education modules really point out aging in general in terms of that specific clinical topic. So you'll see age-related changes as they relate to those clinical topics. And the clinical topics are specific towards older adults who are frail. So that's sort of incorporated into each module without having a separate module on frailty. But we will take that under consideration.
It's Barbara speaking, and I'd just like to add, we are taking requests for other topics to include in the learning series, but we're also looking for the future to develop more resources within the existing topics. So moving beyond the introductory level materials into more in-depth and more specific content. So if you have suggestions for other topic areas, or if you want to get involved in the creation of future materials, we welcome volunteers to participate with us and to make this more of a community effort in terms of creating some of these resources for ourselves, our colleagues, in Ontario. And of course, we make these resources available so they're going to be potentially used by people from outside of Ontario as well.
Great, and I see some extra requests coming in already, dementia and management of responsive behavior, so we'll add that to the list. And some nice comments about how these modules could be great study resources for nurses writing Canadian Nurses Association gerontological certification exam, for RNs and RPNs, and also for allied health professionals preparing to write their licensing exams. So those are great additional uses. Thank you. I just want to say a special thanks again to Shane and Tracy for sharing your implementation plans. And I'm sure when you reached out to me, you didn't expect that I'd make you do a webinar, but this has been really very helpful, I think, and very enlightening to others on this webinar, just to have that practical advice in terms of how you're implementing things and what you've learned along the way. Was really very, very helpful. I want to thank everybody for attending the webinar. You're going to receive a short evaluation survey by email, so please share your suggestions and topics for future webinars with us. Also, don't forget about that social media contest that Alekia mentioned. So follow us on Twitter, Facebook, or LinkedIn and share one or more of our SF Care Learning Series posts to win some prizes. Also, be sure, if you haven't already done so, sign up for our, at the bottom of our website on our homepage, to get webinar announcements and reminders. And with that, we just want to invite you to the next webinar, which is on August 22nd, and it's on End PJ Paralysis, Lessons Learned from Alberta, where Paul Wright, who is the Interim Director of Clinical Quality Improvement, will share lessons learned with the implementation of this initiative across Alberta Health Services. And the registration information for the webinar will be emailed soon. This will also be a very interesting lessons learned on the ground webinar. So thank you very much to all for attending, and we'll see you next time. We're signing off now.